We often think about fundamental human rights, freedom of speech, fair trials, that sort of thing, as separate entities. But what if our mental health is just as fundamental, deeply tangled up with those rights?
That's exactly the connection we're exploring in this deep dive. It's a really complex relationship, mental health and human rights, and we've pulled together a lot of different perspectives.
Yeah, exactly. We've looked at research from psychiatry, law, social sciences, but also, crucially, the lived experiences of people themselves. We're trying to paint a full picture here.
hmm And the goal, really, is to shine a light on where mental health and human rights cross paths, understand the big challenges people face, and, well, find pathways toward a fairer future for everyone with mental health conditions.
Right. Expect some surprising facts, maybe some uncomfortable truths, and hopefully those moments where it all clicks and you see things a bit differently. Okay, let's dive right in with something that's still a massive issue: discrimination and stigma.
Yeah, when you look at the sources, it's quite striking. The sheer um, breadth of discrimination. We're talking adults, children with intellectual impairments, mental health problems. It's not just stigma, it's degradation, sometimes routine confinement.
Confinement? What?
Yeah, against their will. A real undermining of their freedom, dignity, basic rights.
That's hard to grasp the impact, and it seems this vulnerability makes them physically less safe, too. The WHO and World Bank data point to higher risks of injury, violence.
Exactly. And the key thing here is these aren't just isolated cases. It points to, well, systemic failures in protecting people.
Right, systemic failures. And connecting that to jobs, employment, there are huge gaps there, too.
Huge disparities. And it's not just about fewer opportunities. Often it's based on, wrong ideas about what people can do, outright discrimination. These biases run really deep.
Yeah, stopping people from living full lives. And that stigma, that negative perception, it actually stops people asking for help, doesn't it?
Absolutely. It's a powerful barrier. Research, like Andrews and others, really hits this home. The fear of being judged can be just as crippling as the condition itself. Contributes to this huge unmet need for services.
Fear of judgment, yeah.
And then there's this other thing, diagnostic overshadowing.
Diagnostic overshadowing. Okay, what's that?
Well, it's when someone has a mental health diagnosis and then maybe they develop a physical problem
Uh-huh.
and that physical symptom gets dismissed,
Uh-huh.
just brushed off as part of their mental health issue.
Oh, right. Like, oh, it's just your anxiety causing that stomach ache.
Exactly. So serious physical conditions might get missed. It's like the mental health diagnosis casts a shadow over everything else.
That sounds incredibly dangerous. So the diagnosis itself could create blind spots in their healthcare.
That's the worry highlighted in the sources, yeah. Okay, let's maybe shift gears a bit to another really critical piece. Resources, funding for mental health globally.
Okay, yeah. And this is where it gets, well, frankly, pretty alarming, isn't it? The gap, the global disparity in funding, it's huge. The resources just don't match the scale of the problem. The neuropsychiatric burden makes you question priorities.
Hmm. And what's really striking is in many low and middle income countries, LAMIX, mental health funding seems like, well, an afterthought. It's way behind things like infectious diseases or maternal health.
Right.
But even in richer nations, mental health often gets less funding compared to physical conditions like heart disease or cancer, even if the overall health burden is similar.
And the numbers themselves are pretty shocking. For LAMIX, often less than 2% of the health budget, sometimes under 1% in the poorest places.
Yeah, under 1%. And you find a significant number of countries don't even have a specific budget line item for mental health at all.
No dedicated budget line. Wow. That just sends a message, doesn't it? About how much it's valued.
Exactly. And that lack of a dedicated budget, as the sources point out, makes accountability, tracking progress, really hard. Plus, in poorer countries, people often have to pay out of pocket,
Oh, right.
which is another massive barrier, especially for the most disadvantaged. Access to care ends up depending on how much money you have.
It's a real cycle, isn't it? No funding, no access, and the most marginalized get left behind. Okay, let's move to a really complex area: legal capacity and rights. This feels like a core tension point.
It definitely is. It brings up big questions about, how we define and protect the legal rights of people with mental disabilities.
Yeah.
The big framework here is the Convention on the Rights of Persons with Disabilities, the CRPD.
Yeah.
And it strongly pushes for this idea of universal legal capacity.
Universal legal capacity.
Sure.
Can you break that down a bit?
Sure. Basically, it means everyone, regardless of disability, should have the right to make their own decisions, exercise their legal rights. The CRPD says denying the capacity holds people back, limits their opportunities. Article 12 is key here.
Okay, so the emphasis is really on autonomy, self-determination.
Exactly. That's the core idea.
But how does that square with things like involuntary treatment or confinement? That feels like a direct clash.
That is precisely the tension. Even in some Western countries, places with pretty strict legal standards otherwise, there's actually growing pressure to treat people involuntarily,
Mm.
often justified by public safety concerns,
Right, the public safety argument.
which directly challenges that CRPD principle of universal capacity.
Mm.
It forces the question, when, if ever, is it okay to override someone's autonomy for safety?
So even as rules might be tightening in some ways, there's still this push towards coercion, especially if public safety gets invoked.
Mm-hmm. And you see this reflected even in older frameworks like the European Convention on Human Rights. Historically, Article 5 allowed exceptions to liberty for people deemed of unsound mind. Now, Article 14, the non-discrimination part, implicitly covers mental health disabilities.
Yeah.
But the European Court has still dealt with over 100 cases involving people with mental disabilities. So it shows these challenges are ongoing, balancing rights and societal concerns.
Yeah, the legal landscape is clearly still evolving. Okay, let's tackle something really tough. Abuse and neglect within mental health systems.
Yeah, this is deeply disturbing. Our sources show coercion and social exclusion are worryingly common globally in how mental illness is managed. There's this kind of double bind.
Double bind.
Yeah, the dilemma between using coercive treatment, forcing care on someone, or just abandonment, leaving people without the care they desperately need. It really reflects systemic failure.
That's a terrible position to be in or have forced on you. And this trend you mentioned in some Western countries of more compulsory admissions, even extending that into the community with treatment orders. That's concerning.
It is. It makes you question if individual rights are truly being prioritized. And often the reason given is dangerousness. But that term gets interpreted very broadly.
Broadly, how?
Well, beyond significant violence, it can include behavior that's just seen as socially disruptive, which begs the question, who decides what's disruptive? And are there enough safeguards?
Right. And what about people in secure settings? Prisons, forensic units? The risk there seems even higher.
Absolutely. In those settings, the focus on security, on control, can easily overshadow the therapeutic goals. Mental health staff there face this real conflict, between security rules and advocating for their patient. The system itself can end up prioritizing containment over actual care.
It sounds like a really difficult situation for everyone involved. Okay, let's shift perspective a bit. How does culture fit into all this? Mental health, human rights, these aren't seen the same way everywhere.
No, they're not. And this brings up that classic debate.
Yeah.
Universalism versus cultural relativism when it comes to human rights.
Right. Are rights universal or are they culturally specific?
Well, the argument for universalism is that while, yes, the way rights are expressed might be shaped by culture, the fundamental moral concerns, things like fairness, justice, compassion, these are pretty much shared across human societies. Our basic vulnerability as humans is universal.
So the core values are common, even if the expression differs.
That's the idea. Thinkers like Schwader or Haidt talk about shared moral foundations, even if cultures emphasize different aspects. That shared ground supports the idea of universal rights.
But the cultural relativist argument is strong too, isn't it? That you can't just impose one culture's view of rights onto another.
True, but that's where you have to be careful not to see culture as this single static thing. Cultures are complex, they change, they have internal conflicts, power imbalances.
Yeah, right.
So just saying it's our culture can sometimes be used to justify injustice or silence minority voices within that culture. Human rights language can actually empower those groups.
I see. Give them a tool to challenge things.
Exactly. And there's a concept called pragmatic relativism that tries to find a middle ground. It says, okay, let's understand ethical problems in their cultural context, acknowledge differences, but without saying all cultural traditions are untouchable or beyond criticism.
So it's about finding that balance between universal principles and cultural sensitivity.
It's crucial.
Okay. Now, we need to touch on some really dark history here. The past abuses involving mental health and human rights, they're important warnings.
They are vital, though very difficult, lessons. We have to remember how psychiatry was misused for political ends, like in the Soviet Union. Diagnoses like sluggish schizophrenia used to lock up dissenters.
Terrifying. A clear weaponization of mental health label.
Absolutely. And then, even more horrific, the actions of doctors and psychiatrists under the Nazi regime. The sources are clear. They weren't just bystanders. They were active participants in the euthanasia programs targeting people with disabilities and mental illness. These were essentially precursors to the Holocaust.
It's just a chilling reminder of the ethical duties involved and what happens when they're abandoned.
Indeed. And we also need to talk about torture. The impact on mental health is profound. PTSD, depression, the sources are clear on that. And what's concerning now is how the consensus against torture weakened somewhat during the War on Terror,
Hmm.
and the involvement of some health professionals in assessing or monitoring torture. It raises huge ethical flags, especially since there's little evidence they even have expertise in that context.
It feels like fear and politics can erode even the most basic ethical lines. Okay, let's focus now on specific groups who seem particularly vulnerable in this intersection of mental health and rights.
Yeah, the sources highlight several. Individuals with intellectual disabilities, for instance, they often face low expectations, negative attitudes, marginalization, communication challenges,
Hmm.
all leading to rights violations and lack of opportunity.
And women with mental illnesses, they face specific risks too, right?
Yes. While men might have higher rates of homelessness or imprisonment overall, women with mental illnesses in those situations are disproportionately vulnerable to violence, sexual assault, exploitation. Plus, there's the issue of potential misdiagnosis, maybe depression being missed or misinterpreted in women.
Leading to the wrong kind of help or no help.
Exactly. And then there are child and adolescent refugees and asylum seekers. Their situation is incredibly precarious.
Hmm. Detention seems like a huge issue there.
Absolutely. Detaining children as a deterrent is a serious rights violation with potentially devastating impacts on their mental well-being. The focus really needs to be on support, safety, upholding their rights.
And finally, Indigenous peoples. Their rights and perspectives on mental health need specific attention.
Definitely. The UN Declaration on the Rights of Indigenous Peoples recognizes their right to traditional medicines and health practices. It's vital that mental health care and research for Indigenous communities is culturally sensitive, developed with them, respecting their worldviews and healing traditions.
Right. It's about valuing different approaches to well-being, making sure care fits the culture. Okay, so we've mapped out a lot of challenges. What about moving forward? What are the pathways towards a better future here?
Well, international human rights frameworks like the CRPD we mentioned are really important tools for advocacy and promoting rights. And that principle that drove its creation, nothing about us without us, is key.
Yeah, ensuring people with disabilities are central to decisions about their own lives. That feels fundamental.
It absolutely is. Then you have things like the UN Principles for the Protection of Persons with Mental Illness. While not legally binding, they offer important ethical guidance. And you really can't overstate the role of NGOs, advocacy groups, and especially the consumer movement.
The consumer movement.
Yeah, organizations run by and for people with lived experience of mental health conditions. They're crucial for spotting violations and pushing for reform. Groups like MDA, DRI, they do vital work.
So it's not just top-down frameworks, but grassroots action too.
Exactly. And participation is key, involving service users, families, the public, in shaping mental health policy and laws. That's essential for real change.
Makes sense.
And other promising things include, clear codes of ethics for organizations, international charters on patient rights, and focusing on emancipatory practices, approaches that empower individuals and focus on recovery. The RANZCP Code of Ethics is one example of a professional body setting standards.
So it sounds like it needs a mix of everything international law, local advocacy, strong ethics, and always centering the voices of those directly affected.
That sums it up pretty well, yes.
Okay. So as we wrap up this deep dive, it's just crystal clear how tightly mental health and human rights are bound together.
And while there's been progress, there are still huge challenges globally in making sure the rights and well-being of people with mental health conditions are protected.
Yeah. The need for continued advocacy, for real policy reform, and just a fundamental shift towards person-centered, rights-based care.
Mm.
It's undeniable.
Yeah.
Which brings us to a final thought, something for you, our listener, to mull over. How can we, each of us, individually and as a society, actively help uphold the human rights of people living with mental health challenges? How can we help dismantle those systemic barriers they face? Think about the power in the words we use, the importance of empathy, and the need to stay vigilant against discrimination and injustice in all its forms.